Hi everyone. Now we are going to discuss anatomy of shoulder joint with beautiful pictures. First, coming to the contents, there are 8 contents in shoulder joint. First one is type of joint, articular surface, ligaments, bursae, relations, blood supply and nerve supply, movements and muscles. Last one is clinical anatomy. These are the 8 contents present in shoulder joint. Coming to the first one, type of joint. The shoulder joint is a synovial joint of ball and socket variety. It is a synovial joint of ball and socket variety. And coming to the articular surface, there are two articular surfaces present in shoulder joint. First one is glenoid cavity of scapula and head of the humerus. This is the glenoid cavity of scapula, and this one is head of the humerus. By articulation of these both, shoulder joint was formed. In this, we have to mention two important points. First one is shoulder joint has greater mobility and less stability. Why it has greater mobility? The shoulder joint have more movements like flexion, extension, medial rotation, lateral rotation, adduction, abduction, like that. And due to more movements it produces, it has less stability. That stability of shoulder joint was maintained by three important ones. First one is coracoacromial arch. This coracoacromial arch is present from the apex of the acromion process to coracoid process. This coracoacromial arch acts as a secondary socket to the shoulder joint. Coracoacromial arch acts as a secondary socket to the shoulder joint. Second one is rotator cuff. What are the rotator cuff muscles? Supraspinatus, infraspinatus, teres minor, subscapularis. These four muscles also gives stability to the shoulder joint. And third one is glenoid labrum. This glenoid labrum present around the glenoid cavity as a rim. This is the glenoid labrum. It also produces stability to the joint. Coming to the ligaments of the shoulder joint, there are four ligaments. First one is capsular ligament. Second one is coracoacromial ligament. Third one is transverse humeral ligament. And fourth one is glenoid labrum. There are four ligaments. First one capsular, second one coracoacromial, third one transverse humeral, and fourth one glenoid labrum. Now we have to mention at least 1 to 2 points for each ligament. First one, capsular ligament. Capsular ligament attachment is very large. The attachment is very large. This is capsular ligament and permits free movement. Coming to the coracoacromial ligament, this coracoacromial ligament forms from the root of coracoid process to apex of the acromion process. This is the coracoid process from the root of the coracoid process to apex of the acromion process. This coracoacromial ligament is present. It acts as a secondary socket. And coming to the transverse humeral ligament, this transverse humeral ligament present in humerus head. Humerus head contains one lesser tubercle, one greater tubercle. In between them, there is a groove called bicipital groove. This transverse humeral ligament bridges the upper part of the bicipital groove of humerus. Tendon of long head of biceps brachii pass deep to it. This is the bicipital groove. This is the lesser tubercle. This is the greater tubercle. It bridges over the bicipital groove. Beneath the ligament, long head of the biceps passes. This is about transverse humeral ligament. Coming to the glenoid labrum, it is a fibrocartilaginous rim covers the glenoid cavity. This is all about the ligaments of shoulder joint. This diagram is very important. Coming to the bursae. There are so many bursaes present in the shoulder joint. We have to mention at least three bursaes. First one is subacromial bursae. Second one is subscapular bursae. Third one is infraspinatus bursae. Subacromial means beneath the acromion process. Acromion process కింద ఉంటే దాన్ని subacromial bursae అంటారు. Subscapular means beneath the scapula. Infraspinatus bursae means beneath the infraspinatus muscle. These are the some bursaes present in shoulder joint. Coming to the relations, there are four directional relations. First one is superiorly, inferiorly, anteriorly, posteriorly. Relations means nothing but what are the stretches present anterior to the shoulder joint, posterior to the shoulder joint, superior to the shoulder joint, and inferior to the shoulder joint. ఈ డయాగ్రామ్ అనేది చాలా ఇంపార్టెంట్ అన్నమాట. ఇందులో ఇవన్నీ కూడా సుపీరియర్ స్ట్రక్చర్స్. యాక్రోమియన్ ప్రాసెస్, సబ్యాక్రోమియల్ బర్సే, సూప్రాస్పైనేటస్, డెల్టాయిడ్ మజిల్, ఇవన్నీ కూడా సుపీరియర్ రిలేషన్స్. ఇన్ఫీరియర్ రిలేషన్స్ వచ్చేసరికి ఇవి యాక్సిలరీ నర్వ్, లాంగ్ హెడ్ ఆఫ్ ట్రైసెప్స్, ఇవి ఇన్ఫీరియర్ రిలేషన్స్. ఇవి యాంటీరియర్ రిలేషన్స్, ఇవి పోస్టీరియర్ రిలేషన్స్. ఈ డయాగ్రామ్ వేసి ప్రతి దాని కోసం ఎక్స్ప్లెయిన్ చేయాలన్నమాట. ఫస్ట్ వచ్చేసరికి సుపీరియర్లీ. సుపీరియర్లీ ఏ స్ట్రెచెస్ ప్రజెంట్ అయి ఉన్నాయి? ఫస్ట్ వన్ కొరకో యాక్రోమియల్ ఆర్చ్. దిస్ ఈస్ ద కొరకో యాక్రోమియల్ ఆర్చ్. Subacromial bursae. Beneath the acromion process, there is a subacromial bursae and supraspinatus and deltoid muscle. This is the supraspinatus. This is the deltoid muscles. These are the four structures present superior to the shoulder joint. Coming to the inferiorly. Inferiorly, there is a axillary nerve, long head of the triceps, posterior circumflex humeral vessels. Long head of the triceps brachii, axillary nerve, and posterior circumflex humeral artery. These are the structures present inferiorly to the shoulder joint. Coming to the anterior relations. Anterior relations వచ్చేసరికి ఏమున్నాయి? Deltoid muscle, subscapularis muscle, pectoralis major muscle, subscapularis muscle, coracobrachialis, short head of biceps, and deltoid. మనం ఎప్పుడైతే ఈ డయాగ్రామ్ వేస్తామో ఈ రిలేషన్స్ అనేవి ఈజీగా రాస్తాం అనమాట. ఫస్ట్ ఇది జాయింట్ అన్నమాట. ఈ జాయింట్కి ఉండే సుపీరియర్ స్ట్రక్చర్స్, ఇవి ఇన్ఫీరియర్ స్ట్రక్చర్స్, ఇవి పోస్టీరియర్ రిలేషన్స్, ఇవి యాంటీరియర్ రిలేషన్స్. కమింగ్ టు ద పోస్టీరియర్ రిలేషన్స్, there are three relations. First one is deltoid, infraspinatus, and teres minor. These are the posterior relations. ఈ డయాగ్రామ్ అనేది చాలా ఇంపార్టెంట్. బై సీయింగ్ దిస్ డయాగ్రామ్ ఈజీగా ఈ రిలేషన్స్ అనేవి మనం రాసేయచ్చు. కమింగ్ టు ద బ్లడ్ సప్లై ఆఫ్ ద షోల్డర్ జాయింట్, anterior and posterior circumflex humeral vessels and suprascapular vessels and subscapular vessels. These are the vessels which gives blood supply to the shoulder joint. Nerve supply is given by axillary nerve, muscular cutaneous nerve, and suprascapular nerve. These are the three nerves gives nerve supply to the shoulder joint. Shoulder joint. And coming to the movements and muscles. What are the movements present in shoulder joint? Flexion, extension, adduction, abduction, lateral rotation, medial rotation, and circumduction. These are the movements which produced by shoulder joint. But to initiate that movement, muscular action is very important. For flexion, anterior part of the shoulder joint will act. What are the muscles present anterior to the shoulder joint? Clavicular head of the pectoralis major, and anterior fibers of deltoid. These two muscles produce flexion movement. Coming to the extension movement, posterior posterior fibers of deltoid and latissimus dorsi muscles. These two produce extension of shoulder joint because extension is produced by the posterior muscles of the shoulder joint. And coming to the adduction muscles. What are the adduction muscles? Pectoralis major, latissimus dorsi, and short head of biceps and long head of triceps. These are the four muscles which produce the adduction movement. Coming to the abduction, adduction means towards the body. See in this diagram, it is the adduction towards the body. What is abduction? Away from the body. This is the abduction. This is the adduction. Abduction produced by supraspinatus and deltoid muscle. For initial abduction, supraspinatus muscle acts. After that, deltoid muscle acts. Coming to the medial rotation. Medial rotation is produced by the muscles pectoralis major and anterior fibers of deltoid, latissimus dorsi, teres major. These are the four muscles which produce medial rotation of shoulder joint. This is the medial rotation of shoulder joint. Coming to the lateral rotation, posterior fibers of deltoid and infraspinatus teres minor. These produce the shoulder joint lateral rotation. This is the diagram, lateral rotation of shoulder joint. And last one, clinical anatomy. Here I mention only two clinical anatomies. First one is dislocation, second one is frozen shoulder. What is dislocation? Dislocation means it is disarticulate from the articulation surface, and the shoulder joint is more prone to dislocation. Why this is more prone to dislocation means this shoulder joint has less stability than any other joint. Due to the less stability, shoulder joint is more prone to dislocation. Coming to the frozen shoulder, this is commonly occurrence due to some pathological reasons. At the age of 40 to 60 years, the patient complains on progressively increasing pain and stiffness in shoulder joint and restricted of all movements, particularly external rotation, abduction, and medial rotation. These three movements are particularly more restricted in frozen shoulder condition. Thank you for watching. Keep learning.